question.
So terrific. Barry, you have your card up? Robert? Robert? No.
For Mr. Lisade, is that how, Herbie? That's as a California resident and someone who pays a lot of attention to planning, I'm interested. I saw the planning guide you put up there. But what about some of the normal, when I say normal, not specifically disaster-focused long-term planning mechanisms? So, for example, I know we're starting a new state 5-year infrastructure plan. To what extent do you think of and see those as venues for resilience and pre-planning for disasters and things like that, or is that not really considered?
No. So California is a huge state, and Caltrans is probably the biggest DOT that there is. We have a division of research, innovation, system planning that has tons of PhDs. We work with like the Meta Transportation Institute. We have hundreds of planners. So we do have planning documents that incorporate emergency management principles into them. So for long-term planning, resiliency is a word that always comes up. So I don't know if I'm answering your question, but they do take into, for example, Caltrans is now looking at all hazards and risk management. We're developing all hazards and risk management plan. And that's going to be intertwined into our long-term plans for planning for the infrastructure. Folks mentioned sea level rise, extreme weather. All of those things are things that we're trying to address.
Okay. And then to what extent do you collect data about the impacts of what you then build and your ability to respond? And is some of that published? And just interested in that too.
Sure. Let's talk about flooding, okay? Flooding is something that we expect to kill more people in the state of California than any other hazard. Okay, the central region, which goes from Sacramento to, let's say, Fresno. Northern California, we expect 3,000 people. Hayward quake. Southern California, 3,000 people. I forget the name of that. Salton Sea earthquake, fault. Central region, we're expecting 10,000 people to this arc storm event if it ever happens. So we have people that have looked at where we have had flooding problems in the past. We've documented those. We're trying to develop something called Floodcast. And there's an NCHRP panel for that I'm the chair of. And what we're trying to do is look at historical locations of flooding, landslides, mudslides, all of that, and incorporate that into this response tool. So that's just one hazard. And then we have something called Shakecast for earthquakes. So there's a lot of stuff that we're trying to do. Just that there's a lot of, like, what's the priority, there's a lot of things that we're trying to do when it comes to that type of thing, but we do document a lot of, we have after action reports, and we try to close gaps and things like that. So I don't know if I'm answering your question. I hope I am.
So just to make sure of all the tools in the toolbox, so the notion of trying to create healthy communities that have dedicated walking paths, bike paths, those kinds of things are critical. So if you're a community and you've now had a disaster and you have to rebuild, and all of the earth movers are running around in circles, and people are worrying about, as they should be legitimately, getting housing up and restructuring neighborhoods and all the things that have to go on. Some brave soul stands up in the middle of the meeting with all the government people and everybody else and says, if you're going to rebuild the road, you need to put the bike lane on the side. And you're already going to spend $18 billion on the road. You're going to need to build it. And by the way, that railroad line that got ripped up by the onrushing water is perfect for repaving for the new bike path. And so Herbie and then Captain Lynn, you guys go, yes, what a great idea, right?
So the nurse in me says absolutely, and that works if you're talking about a rural, an urban area. But if you're talking about Lake Champlain Islands, where Hurricane Irene, we don't get hurricanes in Vermont, but we did, knocked out a bridge. A bike path isn't going to help someone who's trying to get across the lake to get to the closest Costco or Walmart to purchase groceries at
Well, I
a
want the
better
bridge
price.
too, so I want both.
Yeah.
Why, it's not either or. Give me my bridge and my bike path.
Well, I
What's
think
the problem?
So, so I think we always focus a great deal of attention on urban areas or large groups, but not necessarily the mom and pops. So if you've got somebody who's a motor carrier, a husband and wife team, and they're driving across the United States going from load to load to make their wage, they don't have...
I'm saying, Captain, I'm not mad at them. I want them to have that too. All I'm saying is, why is it either or? Why can't it be both?
I think it could. I would just, again, urge you to think about the smaller places that don't have the same kinds of resources.
No worries. But I just can't get the health part in any of this. In other words, so Captain, we're playing a real life drama here, right? So when people like the health people try to raise this, somebody says that. So now I got to learn to be calm and go, yes, I understand with all due respect that you need to have the tractor trailer has to go and deliver because I want to eat my groceries in the store too. All I'm saying is when you do that, let's also build this other thing. Can't we have both and be on the same page? Herbie, help me out here, brother.
Okay. My background, I'm an engineer, right? I've been a civil engineer for many years. And one of the things that I did on my projects years ago, if there weren't sidewalks, I'd put in sidewalks. If there weren't curb ramps, I'd put in curb ramps. This is the state of, I can't speak for the other states, okay? I'm going to talk about the state of California, which you live in, okay? ADA we take seriously, okay? You want sidewalks? Yes, we're going to do our best to give you sidewalks. The San Francisco Oakland Bay Bridge was just opened up. It's got a beautiful bike path. You know how much that cost us? Okay, you paid for it out of your pocket, okay? Gerald Desmond Bridge down in the Port of Long Beach, they wanted it too. You know, we're talking about hundreds of millions of dollars.
We're at the end of the day, so I'm not going to debate how come the bike path had to get put as an add-on and why it wasn't integrated into the planning from the beginning.
Well, blame the planner, don't blame me. Okay, but it's there, right? It's there. So no matter what, it would have cost the same. So, but we do look at context.
So the question is, in your meeting, Herbie, so this is perfect. I mean, I know this is the end of the day, and I know we're going to go eat, but this is really what this day boils down to, is right this moment. The whole day took us to this moment. You're in a meeting to plan the use of scarce resources.
Right.
And competing demands. And Robert has, I think, spot on from my listening. You're going to do certain things. How does the conversation work? How can our committee affect you in a positive way that creates opportunities that are cost effective and builds in health as an integral component to all the other stuff that's going on at the same time? Teach us what do we have to do in our committee report to get health integrated into the substance of what you do.
Well, if you're asking me, it's a change of culture. You're going to have to get people to think a little bit differently. For one thing, like I said, in the state of California, we adopted the federal model. So now there's an emergency function 8, public health and medical annex. So this is a tool that you could use to leverage assets or whatever during emergencies. Now, if you're talking about like building a bridge or whatever, you know, that's something that's a little bit different. There's environmental justice documents. There's other things involved. But in my world, I mean, I don't build things anymore. I more manage, and you know, so in my world, you know, this document is pretty powerful. So you need to talk to your EMMAs and your OESs. You need to talk to your DOTs. You need to talk to those planners to get your voice heard. You know, you're talking to me right now. I'm going to take some of this stuff back. One thing I did notice as I went through this document, they talked about the California Highway Patrol a lot. You know, they didn't mention transportation a whole lot. There's only so much the California Highway Patrol can do for the health field. You know, so I'm going to go back to Dr. Howard Baker. I guess he's the main Emergency Medical Services Authority, and talk to him about that. So,
Good.
So I don't know if I'm answering your
No,
question.
you're being terrific. So, Captain Lynn, so who in HHS sits with you or can sit with you and start to think about federal responses that aren't zero-sum games, that aren't either or, but that are synergistic? And so if somebody says, if we're going to have a transportation system and we're going to oversee the way roads are built or roads are regulated or roads whatever, I'm committed to finding every opportunity where it is possible, and it isn't possible everywhere. I'll give you your point. Where it is possible, we're going to have roads and transportation systems that facilitate and support physical activity that can be done in a safe and convenient way for the population.
So unfortunately, I think we're kind of in worlds apart, and those kinds of conversations don't take place right now.
Okay. So Esmeralda, is she still here behind me? Did we lose her? Esmeralda. What about Cedar?
He left.
Okay. We're going to introduce you to these people. And I'm going to buy you lunch. Okay.
It's a question.
Oh, they can't take lunch.
Or maybe I should say it later, but, so this is quick. So the city of Fresno adopted a bike master plan 2 years ago. And Fresno is not a liberal city by any stretch. And these conversations never happened there until the chief traffic engineer did a 50-year study about how much it was going to cost Fresno to maintain the unbelievable amount of roads they have under the truck pounding and so on. Then he did another study to say if he took 20% of those lanes out of truck circulation and car circulation and turned them into bike circulation, how much would the city save? And that changed the conversation. And I'm wondering about the potential for some of those sort of conversations. This is why I would ask about the insurance industry, because often we're at loggerheads. And our funding streams and our silos prevent conversations from happening. And I'm interested in
I think that's
those
a great
alternate sort of conversations.
I think Captain Lynn did us a great favor, really, by laying out the reality. I mean, by just saying this is what we're dealing with. I mean, you couldn't have done more for us, because we now have to start thinking about how we deal with this. And I just can't thank both of you. Terrific way. I mean, it's amazing. Everything we did today boiled down to this. To me, this is right there. Now, the only thing that we didn't get in was Daniel saying that it doesn't matter because the community itself will rise up and they will plow their own damn road.
But it's
and they will have their own
It's
damn bike
connected.
paths
It's connected.
because it doesn't matter, because power to the people at the local level. Do I got it? Oh man, I'm good. I'm educable. Thank you all very much. You're terrific. And we're going to do something like go eat food. Now, we're going to need instructions as to how to do that.